able to unmute you and then you can respond to the question. We will again also be recording this. This will be available May 1st for those people that are not able to attend today, so please let your colleagues know that. And I am Bridget LeCompte. I'm the consultant for occupational therapy to the North Carolina Department of Public Instruction. The webinar today will focus on ethical considerations for supporting students with autism spectrum disorders. Our objectives are to discuss best practices for supporting students with autism and OT's role. We will review the updated autism spectrum disorders policy. We will also review the AOTA Code of Ethics, and we will apply ethical and clinical reasoning for decision making. This is the definition of autism that's in our North Carolina policies governing services for children with disabilities. And just wanted to give you guys this definition so that you are aware of what our policies actually say. And this does align pretty closely with our federal policies. There are just a few slight changes that in some of the wording. But autism means a developmentally significant, sorry, oh my goodness, I cannot speak today, means a developmental disability significantly affecting verbal and nonverbal communication and social interaction, generally evident before age 3, which adversely affects a child's educational performance. Other characteristics often associated with autism are engagement in repetitive activities and stereotypical movements, restricted interest, resistance to environmental change or change in daily routines, and unusual responses to sensory experiences. Autism does not apply if a child's educational performance is adversely affected primarily because the child has an emotional disability. A child who manifests the characteristics of autism after age 3 could be identified as having autism if the criteria in paragraph C, 1I of the section are satisfied. And just wanted to make a point that words do matter. As I was being trained with how to support students with autism, I was really taught that we should use person-first language. So we should say things more like student with autism or student with autism spectrum disorder. However, a lot of people really, they accept that as part of their identity, so they do prefer maybe something more along the lines of autistic student. We can also use neutral language, so saying on the spectrum. So if you do not know what someone prefers, simply just ask that person or ask the family what their preference is. And throughout this webinar, I will mostly use person-first language and referring more to students with autism or students with autism spectrum disorder. But sometimes it's acceptable also to say identity first language. And another note about words really making a big difference is looking at labels and how we classify students with autism. It's very common for students with autism to be referred to as either low functioning or having high functioning autism. But these can be really problematic because low functioning kind of plays on the assumption that a student may have an intellectual disability or low potential. And high functioning may actually make you think that they do not have challenges, and it may underestimate those challenges that a person feels or perceives. So overall, this may minimize challenges, strengths, needs, and/or abilities of the person. So best practice is to focus on individual interests, preference, strengths, and needs using a growth mindset. And to frame our thinking with this webinar, I wanted you guys to look at the definition of OT, and this is according to our North Carolina policies governing services for children with disabilities. This is a beautiful definition of OT, and we have Lauren Hollahan to thank for this great definition. So occupational therapy is a student-centered continuum of services provided by a licensed OT or a licensed and supervised OT assistant. OT services assist a student to engage in meaningful and or necessary occupations that allow that student to participate in and benefit from his or her educational program. These occupations may include student role interaction skills, learning academics and process skills, personal care, play and recreation, written communication, and community integration and work. OT may include screening, evaluation, intervention, and documentation, assistance with occupational performance when participation is impaired, modification of environments, both human and physical, and tasks, and selection, design, and fabrication of assistive devices and other assistive technology to facilitate development, promote the acquisition of functional skills, and engagement in meaningful occupations. Also may include integration of occupational therapy intervention into a student's educational program to assist the student in participation and acquisition of goals. Collaboration with appropriate individuals to meet students' needs, including transition planning, and provision of education and information to families and school personnel to assist with planning and problem solving. So what is OT's role in supporting students with autism? And I can actually see the chat now. So if you guys just want to kind of type in some of the roles that you see for OT supporting student with autism spectrum disorder, I will read that out loud. Just kind of want to get an idea of what you guys perceive to be the role of OT. So I see social interaction, participation on the evaluation team, ADLs, sensory supports, another sensory, we have visual supports and sensory supports, assisting students in developing independent work habits, social skills training, advocating, development of independence in their life, accessing academics, increase engagement in classroom activities, communication, life skills, self-care and fine motor, adaptations in educational setting, facilitating them to use adaptive responses rather than adverse reactions to general bumps of life, computer-assisted written expression, family education, graphic communication. Wonderful, thank you guys for contributing. Oh, another great one, interventions and strategies to support optimal engagement in their school day. So as we can see, OT's role in supporting students with autism spectrum disorders really is very broad, and there's a lot that we can do to help support these students. And again, we support more than just sensory processing and motor skills. And using the OT practice framework is a great way for us to advocate for our profession and for our students. So we support occupation, and we see all of the different occupations, which are included, some of them are included in our policy's definition of OT. We have education, play, work, ADLs, leisure, instrumental activities of daily living, rest, sleep, and social participation. We also have client factors. We have performance patterns and performance skills, and then we also look at the context and the environment. It also starts with the evaluation process. So how we evaluate students and collect information not only guides the IEP process, but also how we support students. So we start with the evaluation. We're looking at the occupational profile and the analysis of occupational performance. We're creating the intervention plan, implementing interventions, and reviewing those informations. And then we're selecting outcome measures and applying outcomes. And it's very important that we are collaborating between the practitioner and the client, and keeping in mind that the client oftentimes is a student, but it may also be the teacher or the school environment or even the families. So what are best practices in supporting students with autism? So the first one is that we're supporting team collaboration for participation in the least restrictive environment. We're also remaining immersed in evidence for continual professional development. We're conducting strengths-based evaluations of students. And whenever we're looking at strengths-based evaluations and reports, we're also using multiple methods of assessment. We also want to implement evidence-based interventions, and these should be strengths and interest-based as well. because we know that whenever things are interest-based, often this increases engagement and social interaction. And when we're looking at evidence-based interventions, we're looking at behavior, social emotional learning, psychosocial, social skills, altering the environment, and many of those interventions that you guys already explained earlier. We also want to measure outcomes. We want to collect data, do progress monitoring, and whenever we're documenting and whenever we're collecting data, this really helps us with our decision making using our clinical reasoning throughout each process of the OT process. We also want to look at the AOTA Code of Ethics and how this guides our practice. So there are core values that guide practitioners toward ethical courses of action, but these themselves are not enforceable for disciplinary actions, but just something to guide us in our practice. So the first one is altruism, so concern for the welfare of others. It's also important to value equality, so treating all people impartially and free of bias. Freedom is personal choice, client values, and desires that guide intervention. We also look at justice, so diverse communities that are inclusive, that allow a person to function, flourish, and live a satisfactory life. We also value dignity, so treating clients with respect. Truth, we provide accurate information, whether that's verbal, written, or electronic. The other value is prudence. So we use clinical and ethical reasoning, judgment, and reflection to make decisions. We also have 6 principles that guide our practice, and these are enforceable for professional behavior. The first one is beneficence. So OT personnel shall demonstrate a concern for the well-being and safety of participants. Non-maleficence, that's a really hard one to say. Non-maleficence is when OT personnel shall refrain from actions that cause harm. When looking at autonomy, OT personnel shall respect the right of the individual to self-determination, privacy, confidentiality, and consent. Justice, promote fairness and objectivity into the provision of OT services. Veracity, provide comprehensive, accurate, and objective info when representing the profession. Fidelity, treat clients, colleagues, and other professionals with respect, fairness, discretion, and integrity. So I ask you guys to print out the AOTA Code of Ethics or have it available, because throughout the webinar we will be referencing this and helping us make some of these decisions whenever we're supporting students. Another way that I want to help you guys frame your thinking today is looking at the autism spectrum disorder policy updates. And we're just going to have a very quick overview of this, and I'm not going to go into super long detail with many of the items, but just going over it very quickly. So the definition of autism has not changed. There were some additions and modifications to the required screenings and evaluations. And there was also additions to 2 definitions. One was the behavior assessment related to autism spectrum disorder and sensory processing evaluation. There are also changes to the eligibility criteria for prong 1 only, but not prong 2 or 3. So this is a really great chart that I took off of the North Carolina DPI website. And this just shows you what the new additions were. So the new additions were the motor screening requirement and the sensory processing evaluation requirement. And then there were modifications to the social developmental history, which includes an examination of characteristics of autism spectrum disorder present during the early developmental period. There was also a modification to the psychological evaluation, and the yielding of an overall and intellectual score is not required and should be considered on a case-by-case basis. There's also a modification to behavioral assessment related to autism spectrum disorder. So with the addition of a motor screening, this definition is not new, but the requirement is new. So motor screening includes reviewing written and verbal information, observing the student in a variety of settings, and are administering screening instruments to determine adequacy of motoric function and need for further evaluation. Persons who may screen motor skills are psychologists, specially trained teachers of students with disabilities, including adapted physical education teachers, occupational therapists, physical therapists, and other health professionals. So we may or may not be involved in the motor screening portion of the evaluation. Oftentimes, if we are already completing the sensory processing evaluation, then we may also be involved with completing the motor screening. And just for your information, we do have the guidance on required motor screening, and this is a really great tool for you guys to use. It comes from the North Carolina School-Based OT website. Most of you are probably aware that it exists, but if you do have questions about what a motor screening should look like, please go to that guidance document. So now we're going to talk about the changes in the criteria for eligibility. So for prong 1, to be determined eligible in the disability category of autism spectrum disorder, the following must be demonstrated currently or by history. A, persistent deficits in social communication and social interaction across multiple contexts manifested in all 3 of the following: social emotional reciprocity, nonverbal communicative behaviors, developing, maintaining, and understanding relationships. And I did skip over the sensory processing evaluation because we're going to go back around to it. I really want you guys, whenever we're going through the different prongs, to look at how OT can contribute to some of the other areas of eligibility that extend beyond the sensory processing component. B, restricted repetitive patterns of behavior, interests, or activities manifested by one or more of the following: stereotyped or repetitive motor movements, use of objects, or speech; insistence on sameness and flexible adherence to routines or ritualized patterns of verbal or nonverbal behavior; highly restricted, fixated interests that are abnormal in intensity or focus; and atypical responses to sensory input or atypical interest in sensory aspects of the environment. C, symptoms generally present in the early developmental period, but may not manifest until social demands exceed coping capacities or may be masked by learned strategies in later life. A child who manifests the characteristics of autism after age 3 could be identified as having autism spectrum disorder if the criteria in A and B are satisfied. So again, prong 2 did not change, but prong 2 says that the disability must have an adverse effect on educational performance, which also includes academic and or functional performance. And prong 3 also did not change, but to be eligible, the disability must require specially designed instruction, which means adapting as appropriate to the needs of an eligible child under this part, the content, methodology, or delivery of instruction, in order to address the unique needs of the child that result from the child's disability and to ensure access of the child to the general curriculum so that the child can meet the educational standards within the jurisdiction of the public agency that applies to all children. So next, we're going to take a look at sensory processing evaluation and what is required in that definition. Sensory processing evaluations are performed by occupational therapists. A sensory processing evaluation collects, organizes, and analyzes information specific to how a student's current level of sensory processing impacts occupational performance and participation at school. This information may be gathered through review of educational and medical records, interviews with the student, teachers, parents, and others, detailed in-context observations, and the administration of formal testing instruments, procedures, and techniques. A sensory processing evaluation should include, but is not limited to, as many of the areas listed below as may be appropriate: intensity of response to various sensory experiences, including visual, auditory, olfactory, tactile, taste, vestibular, and proprioceptive stimuli. Also includes sensory motor coordination, the sensory motor skills, and praxis motor planning skills. So moving ahead, I love memes. So I don't know, many of you may not know that, but sometimes I feel like they can describe things in a way that maybe other things cannot. But just based on several of the responses that I've received, some of the questions, some of the conversations that I've had from the field, this is kind of my perception of how I feel like you guys may be thinking what the result of the autism spectrum disorder policy, really what it represents. This is Oprah. You get a sensory evaluation. You get a sensory evaluation. Everyone gets a sensory evaluation. So I feel like many of you feel this way, but the truth is many of you are already doing this work and involved with eligibilities for students with autism prior to this change. So there may be an increase in some of the referrals, but many of you have already been involved with this work. And even though it is required that a sensory processing evaluation be conducted for initial eligibilities, we do know that whenever a student is up for a reevaluation, if that data is still current and relevant from something that was completed in the past, that could potentially still be used in place of doing an evaluation. But again, that would be an IEP team decision about whether or not that information is current and relevant. So whenever we're working with students, sorry, I was looking at the chat. Whenever we are supporting students with autism and whenever we're looking at this new policy, there are really two different lenses that I feel like we can choose from. We can either look at this as a new policy that is solely a mandate, or we can look at this as a new policy that's a point of advocacy for our students and for our profession. Whenever we're at the table for a student being determined for eligibility, this really gives us the opportunity to promote the value of OT and provide access to services for students who may have otherwise not been referred for an OT eval. And we do have a very unique perspective of the person, the environment, and occupation that we do bring to the table. And we know that educational impact is not only on academics, but also social participation and functional participation. So this is your chance to decide. You can decide which way you want to look at this new policy. Maybe it's both. Maybe it depends on the day. But we can look at it from the positive angle or maybe a less positive angle. Now, I want us to take a moment to talk about some scenarios that have come up surrounding evaluating students with autism. The first question that is often asked, and I also ask this of people, is the OT conducting a sensory processing evaluation only, or is it an occupational performance evaluation with sensory components? So I want you to take a minute to think about that question. And then if you would like to make a response, you can use the raise your hand option. And Amy, you may be the one that needs to, I don't know if I can see the hands raised. You may need to navigate that for me. But when you're answering this question, I also want you to think about the principles in the ATA Code of Ethics and which ones could potentially guide your practice in these situations. So I see that Crystal Gaddy made a response. Crystal, would you like to have the mic for a second? It's okay if you say no. I can read your response out loud. Okay, so Crystal said that I can read it. She says, I think with the first question, involving a motor screen was a great way of addressing other types of performances besides academic. And then Kay Neldon said, occupational performance is the basic function of all we do, including sensory processing. Any other thoughts? And then another person says, Lenore says, the evaluation is an OT evaluation of the student's participation in their education which includes the impact of sensory processing on their participation. So exactly, this is also how I view it, is that the minimal requirement is that motor screening and or the sensory processing evaluation, but really we should still be looking at occupational performance for the student, and that should take the priority. I have some more responses coming in. So we've embedded an explicit section to collect data on sensory processing through in-context observation in our master evaluation template, which is an occupational performance evaluation. So, and someone else says, I see it as looking at how sensory processing affects their occupational performance in the educational setting. And children may have sensory features, but we need to determine if they are impacting their education negatively. So the second scenario that I want us to look at is in situations when a practitioner is required to conduct a sensory evaluation, even for a student, this does not seem to require that evaluation. And I've definitely heard some people tell me that, that does kind of is questionable ethically about how to proceed with that, and just wanted to hear your thoughts on that as well. And we have a comment that the principles would definitely include justice and veracity. Would that be for the first one, Janet?
Can you hear me?
Oh, I can. Hi.
I'm sorry, what was, you said, was that?
So I see a response where you said the principles would definitely include justice and veracity. Was that in response to the first one?
That was, you said, what principles guide you in those different practice situations?
Yes. So is that for both the first question and the second scenario, or?
All of it.
Okay, perfect.
Yep.
Thank you. I agree with that. So some other things that came up. Number 2, we would still need to go do a thorough evaluation because we're assisting the team in determining the student's eligibility for special education under the category for autism. And another comment, if you think about the evaluation from a functional or from an occupational performance standpoint, rather than just a sensory perspective, then there is no harm in doing the evaluation, and it may even assist with transition and future planning for students. It also helps the team in recognizing pieces of the student's performance. And the sensory profile may illuminate preferences and behaviors not otherwise observed. I think these are wonderful responses in response to these scenarios. Sorry, I thought I saw another one come through. Let's look at number 3. A student in high school is due for reevaluation, and the only testing that is needed is a sensory processing evaluation to fulfill the new ASD eligibility requirement. However, the OT learns that the student may also be having challenges related to transition and life skills. So what do you do? So some of the responses, we have alert team to observations. And Amy also said, you can give me a thumbs up if you would like to be unmuted. So if anyone would like to speak, you're welcome to do a thumbs up and we will let you have the mic. And then another response, I think the team would need to request additional evaluation by additional team members. You recommend the team request a complete OT evaluation to address sensory and adaptive skills. So whenever we're in the situation, it does bring up some ethical dilemmas. And, we could just do the bare minimum, but it would be best practice that we are looking at all areas of occupation that we could support a student, because this guides the IEP process and really is a way for us to support students whenever we're doing an evaluation. And so it's a great idea to continue with looking into transition, looking at the life skills, and if you need to get more permission, you can do that. Also collaborating with the team is also very important because everyone brings their own unique perspective to the table. Okay, and so Janet mentioned a couple of the principles that apply in these situations, and just some other ones that we may want to look at is principle 1 is beneficence, to provide appropriate evaluation and a plan of intervention for recipients of OT services specific to their needs. Also use to the extent possible evaluation, planning, intervention techniques, assessments, and therapeutic equipment that are evidence-based, current, and within the recognized scope of OT practice. Principle 4 of justice is assist those in need of OT services in securing access through available means. I also included fidelity in there, principle 6, to promote collaborative actions and communication as a member of interprofessional teams to facilitate quality care and safety for clients. So again, I just wanted to bring us back to the definition of OT in the North Carolina policies. So it is our responsibility to look at occupational performance, and nowhere in the policies does it specifically say sensory motor, except for in our request for evaluations, but just in this definition, it's all very occupation based. So we're looking at occupation, and we're looking at those sensory motor skills, but through the lens of occupation. So why do we look at sensory processing as OTs? So sensory processing has a significant impact on participation in daily life for students with autism spectrum disorders. So sensory processing may both hinder and support participation. It may support leisure activities because students with autism may be more likely to engage in certain activities that support their sensory needs or their interests, but it may hinder obligatory occupations. And this may be education, self-care, and sleep, and some of those non-preferred activities that maybe have some sensory components that are challenging to the student. So when a student with autism exhibits more sensation avoiding behaviors, it contributes to difficulties with mealtime, sleep, and school activities. When there's increased sensation seeking, it leads to difficulties with academic performance, attention in the classroom, and social participation. The OTs provide sensory interventions and supports through a variety of methods. Sensory integration therapy, this is generally provided in a clinic type setting. It's usually child-directed play, and it looks at changing neurological processes, and it's usually in a controlled environment and providing controlled sensory input. We also provide sensory techniques and protocols. These are often a little bit more passive. They alter the client's arousal. They're things more like weighted blankets, deep pressure, joint compressions, fidgets, brushing, therapeutic listening. We also provide environmental modifications. We adapt the environment to promote positive sensory experiences and align with the sensory needs and the strengths of that student. We also look at self-regulation. We teach students how to manage their own responses to sensory input and recognize needs. And often, whenever we're using things like the alert program or zones of regulation, this is an example of self-regulation strategies that we use.
Bridget, there's a couple of questions in the chat. Rosemary, can I unmute you?
So my question was, I've retired, but when I left, we had been doing sensory processing evals forever for a pre-referral to go to ADOS. But I'm assuming that we don't have to do you don't have to do standardized tests. A good observation, quality observation that hits the sensory components and describes how it's affecting the educational performance is good enough? Question mark, question mark.
So let me go back to the definition.
Remember, I'm retired.
Way back over here. Okay. So ultimately, yes. I mean, it's up to your clinical judgment, what you feel like is sufficient in collecting the information that is needed for that student. But here on the bottom, it does say, may be gathered through a review of educational medical records, interviews with the student, detailed in-context observations, and formal testing instruments. So really, whatever procedures that you feel like would give you the best information is what you would use.
Because I think sometimes people freak out too much. We have been doing that. It's just writing it up in a more specific fashion that they can, so the teachers can fill out the worksheet, they're not sure exactly how to fill out the part that says restricted performance and all of that. So we need to give them something to fill in, I think.
Yeah, and if you're using something like the sensory processing measure or the sensory profile, and you're seeing that maybe something doesn't align, you can, do observations, you can do your more formalized assessments. It's really up to your clinical reasoning and your judgment in the situation of what you feel like is collecting the most adequate information for that student.
Thank you.
Yep.
I have one more question from Heather. Well, I have several, but can I unmute her now?
Yes.
All right, great. All right, Heather. I cannot unmute you. Oh, there you go.
I didn't really have a question. I don't think it's very clear whether we have to do a formal sensory evaluation. I think sensory evaluation, the term sensory evaluation is getting used kind of differently. I think a formal evaluation like the sensory profile or the sensory processing measure is not necessarily required, but the sensory eval can consist of observations and other things. Formal observations, formal things like that are not really required, but it's not really clear.
Yeah, so it is considered a formal evaluation because it is an evaluation. But what you use, again, is up to your clinical reasoning, and it can include any of those components that are listed in the definition of sensory processing evaluation. And you just have to go off of what you feel like, what information you need. If you feel like you need to do a more formalized assessment, then that's what you do. But if you feel like maybe you just need some sort of checklist and some observations that would maybe be more accurate, you can also use that for your information. So it's not super clear, but there are a lot of options for what you can do whenever you are conducting a sensory evaluation. Alrighty, so we're going to talk for a second about what ethical dilemmas occur when providing sensory interventions and supports to students with autism spectrum disorder. And again, thinking back to the principles in the AOTA Code of Ethics that could guide your practice in these situations. So again, you can either send something in the chat, or you can do the raise your hand feature. Kelly has a great one. Many teachers are now providing their own sensory strategies. Supervision of their use when OT is not present. I think clinical versus school is difficult to get parents to understand. Lack of evidence base for some sensory interventions. Making sure you are using evidence-based practices and materials. Data collection of efficacy, who is collecting and what does it look like. It's important to discontinue strategies and supports when student is resistive. And then questioning, is it really what the student needs? Helping teachers understand that a student's use of sensory strategies may not fit into normal behavior expectations, normal in quotations, but can still be adapted, or adaptive, sorry. Yeah, that's a great point. When completing a preschool sensory evaluation for a student that is not in an educational setting, home can be different sensory needs than the educational classroom setting. And having staff understand that sensory strategies are not needed every day. So you guys touched base on, let's see, sorry, more coming through. We will try to capture these as well later. I think you guys have some really great points, but in the interest of time, I do want to continue on. So you guys have captured a lot of really great points for some of the ethical considerations. Again, we want to look at, are we doing something that's more of sensory integration versus sensory-based strategies? Are we doing something that's maybe more of a medical versus an educational model? We also want to consider the student's least restrictive environment. And if we could provide supports and context, then that's really where we should start rather than pulling a student out into a separate space. We also want to look at issues with parent consent. And one very quick example that I have of this is with weighted vests and compression vests. And you know, some parents see the stigma with that. They may also perceive it to be a restraint. And I've even heard of a situation where for a student who's had trauma, that applying a weighted vest on that student was considered assault. So we just want to make sure that parents are provided informed consent whenever we're implementing some of those sensory strategies that may be a little bit more stigmatizing or may have some kind of negative effect on the student. And we also want to look at potential issues with restraint and seclusion, student safety, and then making sure that we're implementing evidence-based practices. And here we do have a guidance document for supporting students' sensory processing differences. And let's see if I can open it. This may be a bad decision because I don't know if I'll be able to get back into it. Let's see. So this is something that has been put out by North Carolina Department of Public Instruction, and I just want you guys to be aware of this resource, and I'm happy to send it to you later. But
we can't see it, Bridget.
Oh, you can't see it? Okay.
You must be sharing just the PowerPoint.
Okay.
Just switch to share screen instead of share program.
Hopefully, can you see this now?
Yep, we got it.
Okay. Hopefully this does not mess me up later, but I want you guys just to be aware of this document. The EC division does not endorse the use of sensory rooms for the following reasons. And the first one is time in a sensory room may be the equivalent of removal from the general education setting, and as such carry legal implications for repeated removal, suspicion of disability or child fine, educational placement, least restrictive environment, restraint and seclusion, student safety. Placement of students in a sensory room may result in loss of instructional time. And then sensory integration interventions are not identified as evidence-based for students with autism. And there has been some more recent research that has come out where there's a little bit more to the evidence base, but it's still pretty mixed. Schools also rarely have adequate staff who are appropriately qualified or trained to design and deliver interventions using specialized equipment. The equipment can be pretty intense and rarely required as a general education support. They can also be pretty resource hungry areas. And then it kind of goes through just some of the background with this. So just as a reference, I want you guys to be aware that this is out there. And this is more specifically, it seems to be addressing those sensory rooms that are provided to everyone, not necessarily a therapy room. But if you guys do have therapy rooms and you do have some of these sensory supports, I would just be very aware of some of these legal and ethical implications that are outlined below. So I'm going to try to share my PowerPoint again. Okay. Can you see my PowerPoint?
Yes, perfect.
Okay. Great. Okay, and just some of the principles in the Code of Ethics that address some of these issues that we've outlined is Principle 1, beneficence. Use to the extent possible evaluation, planning, intervention techniques, assessments, and therapeutic equipment that are evidence-based, current, and within the recognized scope of OT practice. We also want to avoid inflicting harm or injury to recipients of OT services. We want to respect and honor the express wishes of recipients, fully disclose the benefits, risks, and potential outcomes, and to obtain consent. We also want to look at the principle of justice. We want to collaborate with employers to formulate policies and procedures in compliance with legal, regulatory, and ethics standards, and work to resolve any conflicts or inconsistencies. And I put this one in there just, you know, whenever you are implementing some of these sensory interventions, you just want to make sure that everyone's on the same page with what is expected in the school environment and in that school building or in a classroom. Okay, the next question I have is autism spectrum disorder a disorder to be treated or an identity to be respected? Just kind of want to hear any thoughts on that, or is it both? We have an identity to be respected, identity to be respected, respect, and identity to be understood, respected. We have can't treat the ASD out of someone. Treatment is based upon functional performance. And again, identity to be supported and respected. Identity to be understood, but so often want them cured. So personally, I do feel like it is important to acknowledge that it is a disorder, and there are things that we want, interventions that we want to provide and support the students, but it really is an identity that should be respected, and especially as we're thinking about neurodiversity and just an individual's perception of their own disability or their disorder or whatnot, that should definitely be respected, because more often than not, they do see it as an identity. But it can definitely depend on the family, it can depend on the student. So just some things to be aware of whenever we're working with students with autism. And one area that I think that this really plays a big role is with social participation. We have a lot out there about social interventions, and there's strong evidence for group social programming and providing these supports in contextual settings. We see moderate evidence for virtual reality, video modeling, computer work, activity-based interventions, and then mixed evidence for peer-mediated interventions and social stories. And so we do, as occupational therapists, we do want to support social participation, and Educators want to support social participation, but we also want to honor the preferences of the student and their perceptions of their reality and just who they are. Because some of us, we are naturally introverts. Some of us prefer to play in isolation and be by ourselves. So it's just something to really consider whenever we're working with students with autism. So how do we promote occupational justice for students with autism spectrum disorder? And occupational justice is the right of every individual to be able to meet basic needs and to have equal opportunities and life chances to reach toward his or her potential, but specific to the individual's engagement in meaningful occupation. So how can we promote this in the school setting? One person said, promote by allowing the student to be as autonomous as possible, even if it means using technology beyond what is provided. Educate staff during staff meetings about the strengths of students with ASD. Education to entire school staff about autism. And teach the student how to self-advocate for their specific needs while at school. Education of all IEP team members of sensory strategies and ASD. They deserve recess, to eat in the cafeteria, go to all specials, field trips, inclusion, and not be stuck in one room all day. Try to increase staff awareness and tolerance for diversity and responses to educational process. Since a person's engagement is typically sensory in a sensory world, reports of unusual responses need to be investigated thoroughly and not just reported, i.e., does it affect performance? So again, these are all wonderful ways to promote occupational justice, and some of them that I outlined are that we want to use a strengths-based approach. We also want to identify the student's special interest areas, because we know if we can tap into those interests, a lot of times it can promote occupational engagement and interest in novel activities. We also want to implement the full scope of school OT across the lifespan in practice. We also want to set high standards for our students, i.e. standards-aligned IEPs. We also want to advocate for inclusion, promote self-advocacy and self-determination, and prepare students for transition and community participation. This applies to the Principle 4 of justice. OT personnel shall promote fairness and objectivity in the provision of OT services. As OT personnel, we work to uphold a society in which all individuals have an equitable opportunity to achieve occupational engagement as an essential component of their life. So really, we should evaluate how we are looking at supporting students across the lifespan and providing OT services. In early childhood, oftentimes we are involved with the diagnostic processes, or we're there whenever the parent realizes that maybe something's different with their child or they receive that diagnosis. We also support family routines, bedtime routines, mealtime, self-care. We also provide family and child-centered care, early screening and intervention. We help support play skills. We also help with the transition from maybe early intervention services to preschool, and preschool into kindergarten. In middle childhood, often we focus on social emotional development, motor impairment, participation in activities, also the vulnerability that these students have in school contexts. Sometimes they're more likely to be bullied, And so we want to make sure that we're supporting those students in those avenues and also promoting inclusion for those students. And we also want to look at the school context for that student. In adolescence, we know that there are a lot of physical changes, and looking at how OT can support that. There's also a higher need for independence. We also want to help promote friendships and prepare these adolescents for adult roles and there's also an increase in academic demands, so we want to be aware of that and how we can support those students. And then looking at adulthood, we look at community inclusion and participation, independent living and activities of daily living, employment and vocational rehab, higher education, transportation, and friendships and romantic relationships. And someone mentioned earlier, self-determination. This is a really great infographic from Seek Freaks, and just some strategies to incorporate in our interventions and ways that we can enhance the self-determination. Looking at choice making, providing opportunities for that choice, whether it's relevant choices or irrelevant choices. We want to look at problem solving. Instead of just answering questions for a student, we want to make sure that we're helping them problem solve by asking them questions and guiding them through that process. We also want to let them make mistakes. Sometimes we don't want people to make mistakes and we're a little too protective. We also want to model by thinking out loud and provide novel tasks. We also want to help students with goal setting, allowing them to explore what they want and what their needs are and what their goals are. We also want to coach the child or the youth in setting goal parameters and planning steps to reach their goals. We can also look at decision making, providing opportunities for students to make those decisions, because a lot of times, again, we make those decisions for them rather than letting them make those choices. We can also look at self-regulation, whether that's checklists, teaching them how to identify how they're feeling and some strategies to support them. It also can help look at leadership and providing opportunities for that student to maybe engage in a job task or leading a small group activity or something in the classroom, or even allowing the student to participate in his or her own IEP meeting. We can also promote self-advocacy, modeling and practice communicating one's needs, coaching the child or the youth on some positive phrases for seeking assistance, and self-advocating for his or her own needs. We also want to help promote self-awareness, exploring inventory of their skills, ways that their strengths can be used to overcome weaknesses. And this also aligns with Principle 3 of the AOTA Code of Ethics, that OT personnel shall respect the right of the individual to self-determination, privacy, confidentiality, and consent. So we want to respect and honor the express wishes of recipients of services. We want to fully disclose the benefits, risks, and outcomes of an intervention, obtain consent, establish a collaborative relationship with recipients of service to promote shared decision-making, and respect the client's right to refuse OT services temporarily or permanently, even when that refusal has potential to result in poor outcomes. And I think E is especially important as we're supporting students in adolescence or early adulthood, and making sure, of course, that we're allowing them to have informed decision making, but we're also respecting them, especially if we're working on something like social skills and maybe it's making them feel uncomfortable or not something that they want to work on in that moment. So another area that we want to look at is leisure. So we know that engagement in leisure activities is significantly correlated with quality of life in individuals with ASD. And quality of life with individuals with ASD has been consistently found to be lower than that of typically developing individuals in studies across the age span from childhood to adulthood. There were really no significant differences from age 6 to 10 on physical activities, skill activities, and jobs or chores, but they were significant from age 11 to 17. Social activities were also significantly lower for students ages 16 to 17, and recreational activities were not significantly different at any age. So overall, children with ASD participate less in most leisure activities than children without ASD. And the gap becomes greater in adolescence, which can lead to limited participation in employment, living independently, and attending college. It's also important that we address activities of daily living, instrumental activities of daily living, and even some things with sleep. So adults with ASD with the highest performance of ADL skills are the most likely to maintain employment and require fewer supports. Adaptive skills are the most highly associated predictor of positive outcomes for individuals with ASD. And a national longitudinal transition study found that only 17% of adults with ASD lived independently, and sleep problems occur in 40 to 80% of children with ASD, compared to 25% of typically developing children. It's also important that we're looking at work. Overall, only about 20% of people with disabilities are employed, and the average rate for the rest of the population is 69%. And this was a study that was completed looking at young adults with autism in their early 20s, and they had far lower rates of employment than their peers. So this number does look pretty high, but this is the percentage ever worked after high school. So autism, a student with autism, it was a 58% rate of employment, whereas it's 74% for intellectual disability, 91% for emotional disturbance, 91% for speech language impairment, and 95% for learning disability. And some of the employment factors that were found were household income. Nearly 33% of those from lower income households were socially isolated. Oh, sorry, wrong statistic. Nearly 72% of those from upper income households ever worked after high school, compared to 33% of those from the lowest income households. Race and ethnicity were also a factor. Twice as many white young adults worked compared to Black and Hispanic young adults. Conversation ability was also a huge factor. Nearly 90% of those with the highest level of conversation skills ever worked, compared to 15% with the lowest conversation skills. And then work experience. The employment rate was over twice as high for those who worked for pay during high school, 90%, versus those who do not, which was at 40%. As OTs, it's also important that we're looking at community participation, because we know that community participation not only includes a physical inclusion, but also the perception of being included, so the psychological inclusion. And this can improve quality of life and promote positive outcomes for students. So young adults with autism had higher rates of social isolation within the past year than their peers with other types of disabilities. With 24% in comparison to intellectual disability at 8, speech language at 3, emotional disturbance at 2, and learning disability at 2% as well. And so the social and community participation factors that contributed, again, were household income, race and ethnicity, conversation ability, and then also living arrangement. So young adults who ever lived with their parents, through 22%, were less socially isolated in the past year than those who ever lived in a supervised setting, which was 43%. So ultimately, whenever we're supporting students with autism, we want to promote occupational justice, and we want to make sure that we're addressing a variety of occupational needs and occupational performance at a variety of stages in that student's life. Now I just want to take a moment and ask you guys if there are any other ethical dilemmas that you have encountered when supporting students with autism spectrum disorder that you would like to talk about. So it seems there may be, I see something with.
It's the pre-test on the test itself, not on the slide. Everyone's confused about the pre-test.
Okay, well, we can fix that. That's not a problem. It's probably just an error whenever I was typing it.
Crystal, can I unmute you?
Yeah, Crystal, if you don't mind speaking, it might be a
Yes.
little easier.
Can you hear
to
me?
get your question.
Yes, we can hear you.
Okay. So it's a question, but it's also an ethical dilemma. Is sometimes we've been into meetings and a parent has done a great job at bringing an advocate or just educating themselves from home and community as to what their student needs. But sometimes when that advocate comes in, they're clearly on an agenda that's not focused or does not understand exactly from the academic standpoint what the student needs and how like sensory or their performance is being affected because of the autism. And sometimes things just get put out there as blanketed, and you clearly see that it's not with the mindset of what the student needs.
Yeah, I think you bring up a great point, especially as families are becoming more informed and they're seeking advocates, and a lot of times they're advocates that are on the same page with the schools and they really have a great understanding of the student. And then other times we see advocates that do not and seem to be there on their own agenda. And as practitioners, we still have to advocate for our students and provide the information as clear and accurately as we can, and make the best decisions possible in that situation, and just keeping families informed, and making sure that you're collaborating on the team as well, collaborating with the parent ahead of time, and so that it's not the parent and the advocate versus the entire team, that everyone is seen as an equal team member. But thank you for bringing that dilemma up. I think that's a great point. So Franklin, you bring up a great point. A common dilemma is when an LEA prefers to avoid difficult conversation and chooses the DD category and waits until the child is 8 to use the AU category. Does anyone have any experience with how you have addressed that issue? Either Franklin, you can answer, or if someone else has some input. So we have one comment that I'm okay with staying DD. The IEP is still hopefully going to address the student's specific needs. Another question is, would the services and support be different if it was DD versus AU? And I think all of these bring up some great points, and we get into situations where we do kind of have to pick our battles and tread lightly and try to provide the team with as much accurate information that we can, and help support them in decision making, but also looking out for the best interests of the families and that student, and considering how challenging it is for a parent to hear that their child has autism. And Crystal says, Frank, we feel that we have conquered this by educating all professions on a team, showing respect to what we all have to bring to the table, and validating what others have to say as well. And then someone else says, I can say staying with DD is not typically done in our county. We do as a team choose the category that best fits the student at that point in time. Someone else said, I think teams should have a conversation where pros and cons are discussed. And then we have, I think when the intellectual skills are not assessed, it may be difficult for the IEP team to determine if the skills are related to AU or possibly a cognitive impairment as well. A lot of times parents are hearing the words AU for the first time and are just not ready to accept. Services are not different, but AU can be a tough pill to swallow. And honestly, I see many kids change from preschool to 8. We need to remember the IEP team does not diagnose autism. We are only able to determine if the student meets eligibility criteria. We need to be sure parents understand that. That's a really great point. Okay. So it doesn't look like there are many more ethical dilemmas that I've seen pop through. I may have overlooked something, but I do have just a couple more things that I wanted to share with you guys. Oh, this is not super clear, but I want to talk to you guys a little bit about appreciative inquiry. And I'm not sure if many of you are aware of what that is, but it's a strengths-based positive approach to asking questions and making change. So we basically are looking at identifying what works well, why it's working, and trying to do more of it. So again, we can look at things more from an asset-based lens, looking at what we've got, or a deficit focus, look at what we're missing. And I just want to walk you guys through the process of appreciative inquiry in this situation. We're going to look at discovery, dreaming, designing, and destiny. So I want you guys to think about some of the things that we talked about today, or some things in your practice focused on students with autism spectrum disorders. And I want you to discover first, appreciate the best of what is. So look at some of those bright spots. Look at what you're doing either in your practice or what you're doing on your school teams or in your OT departments. And just think about some things that are going very well for you. And if you have a piece of paper or a sticky note, just write that down for me. You're, of course, welcome to enter it into the chat if you would like, but definitely write that down. I'll give you just about one more minute, and then we'll go to the next one. Okay, so hopefully you have discovered a positive in your own practice with supporting students with autism. And next, I want you to dream. I want you to envision what could be. What could you do either in your practice or if you have a student in mind? What do you envision that they will be doing in the future? Or what, as your OT PT department, what will you be doing in the future? When you're dreaming, it could be a wild dream, it can be exaggerated, it could be extreme, because that's what dreams are, and there's no judgment for that. Just so think outside the box as much as possible with it. And if you don't feel like you have enough time right now to do this, I would really encourage you to do this after the webinar or in the next couple days to help frame your thinking. So next, I want you to design co-constructing what could be. So thinking of your action steps. What could you do to make this possible? What's maybe one thing that you can do, one or two things, even three if you're feeling brave. Just think of how you would actually implement this and get this started. So hopefully you've come up with some next steps. And now I want you to think about your destiny and how will you sustain what will be? So you've come up with your action plan, and how will you make sure that that continues? So Roxanne said we have a great team who share ideas, help each other out, and communicate frequently. Roxanne, would you feel comfortable? I know, kind of putting you on the spot. Would you want to share anything else in your steps? It's okay to say no.
Hi.
Hi, Roxanne.
I actually didn't, you said write a note to yourself, and I wrote that note to myself, and I accidentally pressed enter, and so I shared it with everyone. But you were saying to what do we feel we do well? I really feel our team collaborates and we share ideas. We're constantly helping each other out and motivating each other, and so I think that's a great positive. And for our students, for my students, I'd like for them to feel successful and to have developed meaningful, happy relationships at school. And how to get there? I think one thing would be with this teletherapy would be to continue learning more and not to get burnt out and overwhelmed. And I'm still giving more thoughts about sustaining that and how to work towards those goals in these different times. Those are my thoughts so far.
Great, thank you for sharing that. I also see Tammy said, I would really like to actively tackle the employment issues, and I think more involvement by OT in transition process is critical. And I 100% agree, Tammy. Would you want to share anything else about your appreciative inquiry in this process?
Yeah, I just think it's just so critical that we get involved with, the other team members as far as being a part of that transition planning process.
How could you get more involved in that process?
Well, we started going to some of their meetings, and I just would like to see us not only, going to the meetings is helpful because we know a little bit more now, like what they're doing as far as helping some of the kids with some of their in-school jobs and out-of-school jobs and that kind of a thing. But I just don't think we're tackling it from an OT standpoint yet as far as, the kinds of skills we're working on during their OT sessions that also work towards that. So I would just love to really come up with a way to kind of make sure that across the board we're starting to look at those transition skills and what we can do. So as far as like working on it, that's one of our big things that I really want to do. I really want to write goals that are more related to that transition plan.
Mm-hmm. Yeah, that's a great start. And sometimes it's just starting with that one individual, that one team member, and then kind of expanding it as you go along, and having those discussions and conversations with people in your school building, on IEP teams, with families, with students is really important. Thank you for sharing.
No problem.
So Karen Ellis says, NCOTA is working on putting together a group of OTs interested in supporting adolescents. A survey was sent out if you are a member of NCOTA to work together as a state to see what OTs are doing. And Karen, I will also be sending that out on my listserv as well. I did receive that and have permission to do so. And Kathleen says OT can be instrumental in pre-vocational skill development, especially in middle school. But thank you, everyone. We are done with our time today. I really appreciate your attention and your engagement in this webinar. I hope you found it to be helpful and give you a positive light to move ahead in these challenging times. But feel free to reach out to me if you have any questions. Email is usually the best way, but you can also call me as well.
Everyone, before you go, you should receive an email with a follow-up post-test and a link to the copy of these slides probably later on this evening. Okay? Thank you.